On Tuesday, Minister Anand and Minister Haidu announced that the government has signed an agreement with Abbott Rapid Diagnostics for up to 20.5 million rapid tests. The COVID Alert app is up and running in 8 out of 10 provinces, now including PEI, and has been downloaded more than 4 million times. The more people use the app, the more powerful this tool will become. It's another way for each of us to do our part to protect our loved ones, our neighbours, and our fellow Canadians. Les augmentations de nouveaux cas.
Increases in new cases put enormous pressure on hospitals and health workers who are more and more overwhelmed. Together, we succeeded in planking the curb in the spring, and we can do it again. More than ever before, we have tools at our disposal. On Tuesday, Ministers Anand and Haidu announced an agreement that will enable us to procure up to 20.5 million rapid tests. In addition, 8 out of 10 provinces, including Quebec and PEI, are now using the COVID-19 Alert app, which has been downloaded over 4 million times in the country. The more people use this app, the more effective it will be. It is a tool for all of us to protect our loved ones, our neighbors, and our frontline workers. So I encourage all of you to download this app free.
Our top priority is keeping Canadians safe as we support people through this storm. This morning, we received the news that 378,000 jobs were added to the economy in September as the unemployment rate continues to go down. This is good news for a lot of people, but we also know that there's still lots more work to be done. Earlier this week, Canadians could begin accessing the Canada Recovery Sickness Benefit and the Canada Recovery Caregiving Benefit for people who are not covered at work if they get COVID-19 or if a family member gets sick. Next week, applications will also open for the Canada Recovery Benefit, which is replacing CERB for those who can't access EI. At the same time, we're also looking at how else we can support businesses, as we outlined in the throne speech. Today, we are announcing new support for Canadian businesses so that they can keep workers on the job and get through the coming months. Deputy Prime Minister Freeland will provide more details, but here's the bottom line. Even if many businesses have now reopened, most are not back to full capacity, while many others are facing the uncertainty of a second wave. Our goal is to support Canadian employers and help businesses bridge to better times. That's why we are updating support for commercial rent and mortgage payments with the new Canada Emergency Rent Subsidy. This will provide support to businesses directly, not through landlords. For businesses who've seen a revenue drop, the new rent subsidy can support up to 65% of eligible expenses and up to 90% for businesses temporarily shut down by a mandatory second wave public health order. At the same time, we are extending the wage subsidy at a rate of up to 65% of eligible wages to December and expanding the Canada Emergency Business Account for those small businesses that need it, including with an additional $10,000 forgivable loan. We'll also work to target financial support directly to businesses that have temporarily shut down as a result of local public health directions. We know this second wave will be even harder for those who get hit. That's why our response needs to be targeted and effective. Small and large businesses create jobs, drive our economy, and make our communities stronger. Our government will continue to do whatever it takes to support them. Comme on l'a mentionné lors du discours.
As was mentioned in the throne speech, our government will continue to support businesses going through difficult times in this crisis. This morning we learned that 378,000 jobs were added to the economy in September and that the unemployment rate continues to drop. This is good news, but there is still much work left to be done. Though many companies are open again, The economy is not firing on all cylinders again yet, and many businesses are suffering from uncertainty because of the second wave. That is why we are adjusting our programs, creating a new Canada Emergency Rent Subsidy. This support will go directly to businesses that have lost income because of the crisis. The benefit could reach up to 65% of eligible expenses and 90% for companies that need to temporarily shut down following local authorities' public health orders. We are also extending the wage subsidy, going up to 65% of eligible wages until December, and the business account by adding $10,000 in forgivable loans for small businesses that need it.
Nous prévoyons du soutien
We are also planning targeted financial aid for businesses that must temporarily close to fight outbreaks. We know that the second wave will be even more difficult for those who are affected. Our response needs to be targeted and effective.
pour plusieurs.
For many people, Thanksgiving is a time to share a nice meal with friends and family. Even if this year that tradition is upheaved, we can't forget that there are Canadians who are living with serious food insecurity. This sad reality was accentuated by the pandemic. In April, we announced an investment of $100 million to make food services more accessible for Canadians in need. Today, I announced that we will spend, or rather invest in, an additional $100 million locally and regionally. These funds will flow through the Emergency Food Security Fund of Canada, and Minister Bibeau will be giving more details in a few moments. This morning, I went to the grocery store in order to buy food to donate to a food bank, and I was told a few tips regarding donations. I know that many Canadians are thinking about those in need during this time of Thanksgiving. It is easiest for food banks when we donate certain items, so I encourage you to look into this. The government encourages everyone to reach out to those most vulnerable, and we encourage everyone to do their part.
$100 million in emergency funding to help food banks and community organizations with their vital work. Today, I can announce that we're putting another $100 million towards supporting food banks, local food security organizations, Indigenous groups serving vulnerable people and communities, and partners for northern communities. Last night, I had a video call with Food Banks Canada and got to hear from incredible volunteers and staff from right across the country. They do remarkable work supporting vulnerable Canadians every day, and that includes this Thanksgiving weekend. No one should be left behind, regardless of where they live. In July, when we finalized the Safe Restart Agreement, the federal government and the First Ministers recognized that smaller jurisdictions face distinct challenges and circumstances. Today, I can announce that additional top-up funds of over $37 million will be included in the first payments to the territories under this agreement. A supplemental $41.4 million will also go towards air carriers to ensure essential air services to remote communities in the north. Minister LeBlanc will have more details in a few minutes, but I want to especially thank MPs Larry Bagnall and Michael McLeod and our Minister of Northern Affairs, Dan Vandal, for their leadership and their important work on supporting our northern communities. Je sais que la longue fin de semaine arrive.
I know the long weekend is coming up, and many people are disappointed not be able to get together. Thanksgiving this year will be different, but we are all committing together to do everything we can to slow the spread of the virus over the coming weeks so that we can have a chance to get together in person at Christmas with our loved ones. Every time that you wear a mask, every time that you stay at home when it's not necessary to go out, every time you help a friend to download the COVID Alert app, you're part of the solution.
May be temporarily changed by this pandemic, but our resilience and our determination remain strong. What we do now will shape the numbers we see in 2 weeks and set us, hopefully, on the right track for family gatherings at Christmas. So let's work together and let's flatten the curve. Merci.
Thank you. Now I will give the floor to our Deputy Prime Minister, Chrystia Freeland. Thank you, Prime Minister.
Of this pandemic, our government has supported Canadian businesses hurt by COVID-19 and its economic fallout. This includes help with payroll costs through the Canada Emergency Wage Subsidy, interest-free loans and grants to small businesses through CBA, and rent assistance. In last month's speech from the throne, our government committed to further steps to help businesses weather this storm. In keeping with this pledge, today we are announcing additional targeted support for businesses and their workers. I want to stress that this is not for everyone. Some businesses are able to work at full capacity despite COVID-19, and they are doing well. And that's great. This support is not designed for them. These measures are targeted to help those who need it most for the time when they need it. The difficult reality is that the health measures we are taking to contain COVID-19 mean there are some businesses that simply cannot operate at full capacity, and some are closed down by public health orders. These measures are to support those businesses and to provide a bridge for all of us to the full containment of the virus. As the circumstances of businesses improve, support will decrease. If circumstances worsen, it will increase. That is an automatic feature built into these programs. These measures are the result of ongoing consultations by me and my office, by Mary Ng, the Minister of Small Business, Export Promotion and International Trade, and her office with affected businesses. We have also been working very closely with the provinces and territories. And I want to stress that these consultations will continue as we adjust to meet ever-changing circumstances. I also want to particularly thank National Revenue Minister Diane Leboutillier, the Commissioner of the CRA, Bob Hamilton, and everyone at the CRA for so effectively delivering critical support to Canadians. Alors, les programmes.
Now, for the programs. Firstly, we will put a new emergency subsidy in place for rent assistance. This benefit will make it possible for businesses and other organizations who have experienced income decrease during this crisis to have access to rent support until June 2021. This new benefit will replace the Canada Emergency Commercial Rent Assistance, which ended at the end of September. It will cover up to 65% of rent costs where mortgage interest rates, or for businesses rather, that were hardest hit, which means that their income decreased by 70% or more. For businesses that suffered income decrease of less than 70%, the benefit will gradually decrease accordingly. This will enable us to deliver more targeted and more accessible aid. This is a similar approach to the one used in the Canada Income Support Program, which has been very successful. To simplify the process for businesses, The Canada Emergency Rent Benefit will flow through the Canada Revenue Agency. I would like to highlight an important point. This benefit will be directly accessible to organizations and businesses at a local level. It will be directly accessible to tenants. Secondly, as we promised in the throne speech, we will provide targeted assistance, or rather additional targeted assistance, to businesses that have had to once again temporarily close because of the second wave. We know that across the country, while we are fighting against the second wave, public health authorities are imposing new restrictions. And that is the right thing to do. At the same time, it comes at a cost. This targeted support will help businesses to get through new confinement and will help us all to make the right choice. Businesses that are going through confinement will have an additional 25% admissibility according to their shortfall because of the pandemic. Thirdly, we are extending the Canada Emergency Wage Subsidy until June 2021, as we announced in the throne speech. We are also changing the rate to 65% until December 19th. This measure will help businesses to extend jobs, retain their workers, and will encourage employers to rehire their workers. Finally, the government is enhancing the Canada Emergency Business Account, or CEBA. This will make it possible for businesses that are already eligible to obtain an additional loan of $20,000 according to their needs. Up to half of this additional assistance will be, or which is rather, $10,000 can be transformed into a grant if the loan is paid back by a certain date. The limit to apply has been postponed until December 31st, 2020. In order to be eligible, businesses must prove that they have income losses attributable to the pandemic. Businesses must have suffered attributable income losses because of the pandemic. The opening date to apply will soon be announced in the coming days. I would like to highlight once again that this is targeted support according to businesses' needs. It targets businesses which, for reasons independent of their wishes, are not able to operate at full capacity owing to measures put in place to fight the pandemic.
We are announcing today. First, we will introduce a new Canada Emergency Rent Subsidy. This program will provide access to rent support until June 2021 for businesses and other organizations that have lost revenue in this crisis. This new program replaces the Canada Emergency Commercial Rent Assistance Program, which expired at the end of September. The new program will cover up to 65% of rent or mortgage interest payments for the hardest hit businesses with a revenue decline of 70% or more. For businesses that have experienced a decline of revenue of less than 70%, there will be a gradually decreasing level of support in line with the decline in their revenues. This will be a way of delivering more targeted and accessible rent support. The program mirrors the successful Canada Emergency Wage Subsidy and will be delivered by the Canada Revenue Agency to make the application process easier for businesses. I want to stress one element of the plan. This support will be available to businesses and other organizations that rent their premises. This will be available directly to tenants. Second, as promised in the speech from the throne, we will provide additional targeted support to businesses subject to additional lockdown restrictions. We know that across the country, as we fight the second wave of COVID-19, public health officials have been imposing new restrictions. That is the right thing to do, but it imposes costs. This new targeted support will help businesses get through the lockdown and help all of us to do the right thing. The lockdown businesses will get a top-up of 25% of eligible rent in the event of a temporary closing and revenue shortfall due to a mandatory public health order caused by the pandemic. Third, we're extending the Canada Emergency Wage Subsidy until June 2021, as promised in the speech from the throne, and we're freezing the current subsidy rate of 65% of eligible wages until December 19th. This will help businesses keep workers on the payroll and encourage employers to rehire employees who had previously been laid off. And finally, we are expanding the Canada Emergency Business Account, or CEBA, which will enable businesses who have already qualified for a CEBA loan to get an additional loan of $20,000. Of this additional financing, up to half, or $10,000, will be forgivable if repaid by June 31st, 2022. The application deadline for CEBA loans is also being extended to December 31st, 2020. To qualify for this second round of support, businesses will need to attest to losses in revenue due to the pandemic. Details of when and how to access this new funding will be announced in the coming days. Again, I stress that this is targeted support based on need. It is for businesses that, through no fault of their own, cannot operate at full capacity because of public health measures put in place to fight the pandemic. These targeted measures will provide a bridge for our businesses and for all of us to get through to the other side of this pandemic. And they will give businesses and communities and public health officials across the country the economic support they need to fight the pandemic in a smart, targeted way. They will help us all to do the right thing. This is the economically smart thing to do, and it's the right thing to do. Merci.
Thank you.
Je vous souhaite tous
And I wish you all a happy Thanksgiving.
a safe and happy Thanksgiving. And now I'll turn it over to Minister Bibeau. Marie-Claude, à vous la parole.
Merci, Ministre.
Thank you, Minister Freeland. Hello, everyone. Thank you for being with us today. Over the past days and months, managers and volunteers at food banks have doubled down to respond to the exceptional need of vulnerable people, and I want to thank them. We know that despite all of the aid offered by our government, the second wave of COVID-19 is costing so many people their revenue. Food banks still have to meet the needs of so many families, single people, people in all sorts of situations in all of our communities and in the north of the community. So today I'm very pleased to join the Prime Minister to announce that we are doubling the Emergency Food Security Fund with the second investment of $100 million.
Proud to support our second investment of $100 million in the Emergency Food Security Fund. Up till now, that funding has supported more than 1,800 local food organizations across Canada including 6 million meals for 2 million Canadians from coast to coast to coast. To give you another example, through the Food Surplus Rescue Program, we have distributed over 1.3 million pounds of turkey to the Food Banks Canada network. Throughout the pandemic, food banks and organizations addressing food insecurity have worked tirelessly to help Canadians in need. I would like to thank everyone who has donated to their local food bank, food organizations, and encourage all of those who can to consider giving. For our government, letting local food organizations face the pandemic alone was out of questions. And this is why, in addition to the $200 million, we have invested $50 million to redirect surpluses from the agri-food sector and $25 million in Nutrition North to help promote communities access food. En terminant, je souhaite remercier tous.
To conclude, I would like to thank all workers in the food sector. Now I will give the floor to the Minister for Intergovernmental Affairs and the President of the Queen's Privy Council of Canada, Dominique Leblanc. Thank you, Marie-Claude and Prime Minister.
Would be investing $19 billion through the Safe Restart Agreement to help territories and provinces respond to COVID-19. Provinces and territories are now using these funds to meet their local priorities, such as improving testing capacity and offering wage top-ups to essential workers. We also recognize that remote, isolated, and northern communities have unique needs, which require additional funding and support. Today, as the Prime Minister noted, we are announcing territories will receive an additional federal investment of $37.2 million to the Safe Restart Agreements. Our government also understands just how critical northern air services are, from ensuring food supply chains remain intact to providing medical care and transportation needs to some of Canada's most remote communities. This is why we are investing an additional $41.4 million to maintain these airline services. With today's announcement, to be precise, Yukon will be receiving $19.6 million in additional support from the Government of Canada. The Northwest Territories will be receiving $29.3 million, and Nunavut will be receiving $29.6 million. I want to thank Premiers Silver, Cochrane, and Savikatak for their hard work in keeping their communities safe and their continued leadership throughout this pandemic. And as the Prime Minister noted, members of Parliament Michael McLeod and Larry Bagnall have also been fierce defenders of the unique needs of their territories. Nous allons continuer de travailler.
We will continue working in partnership with the provinces and territories to support Canadians during these difficult times.
Deputy Prime Minister said, Happy Thanksgiving, and I'm now happy to turn it over to our colleague, the Minister of Health, Patty Hajdu.
Well, thank you very much, colleagues. Pleasure to join you and Prime Minister today. Listen, living through a global pandemic has not been easy on anybody, and our lives have all been disrupted and upset. We've all had to change and adapt so much. Families have been strained. People have lost jobs. We've had to let go of celebrations, change our plans, and forego seeing our loved ones. And then on top of that, many of us have been separated from our friends and our natural support networks, just as we need them the most. And of course, far too many lives have been lost to COVID-19 here in Canada and indeed around the world. And now, as winter approaches and Thanksgiving is this weekend, we're missing our routines that much more and our loved ones. But we do need to reduce our contacts, because when we reduce our social contacts and stay close to home, keep our gatherings limited to our households, this is indeed an act of love, even if it doesn't feel like it. COVID-19 is a very sneaky virus, but if we all keep our Thanksgiving small this weekend, we can keep it out of our homes and keep people out of intensive care over the next several weeks. Each of us has it in our power to reduce the spread of COVID-19. Demain est la journée.
Tomorrow is World Mental Health Day. We can't ignore the fact that the extraordinary circumstances we are going through affect us. For some, this pandemic might have been the first time that you've had to live with anxiety, fear, or not as good mental health. The pandemic has also been an obstacle for accessing mental health services. That is why we have established online resources. And the pandemic may also have led some people to increase their consumption of certain substances.
People to get mental health resources to manage through this pandemic. I will remind everyone to visit wellnesstogether.ca to see what is available. But different things work for different people. So to better understand what can help protect the mental health of Canadians, today I'm announcing that our government, with our provincial partners, are investing over $10 million. This funding will support COVID-19 related mental health and substance use research projects across our country. The project will be led by the Canadian Institutes of Health Research, and it will support 55 research teams to understand how the pandemic is affecting different groups of people and what can help them to protect their health and feel better. A couple of examples include Dr. Matthew Sloan at the Centre for Mental Health and Addiction, who will test a remote treatment service to help people experiencing alcohol withdrawal. Dr. Deborah DaCosta at the McGill University Health Centre will evaluate the need for an online program that can address the mental health needs of pregnant women and new mothers. And Dr. Penny Corkum at Dalhousie University will study the benefits of a virtual intervention to promote good sleep and mental wellness for children and families. This funding was made possible thanks to the collaboration with our provincial partners, and I want to thank them for continuing to work with us on this important initiative. On behalf of our government, I would like to thank the researchers and their teams who are doing this incredible, critical work very quickly to help improve the lives of Canadians. Thank you.
Bonjour tout le monde.
Good day, everyone.
So before we provide an update on the national epidemiology and modeling work that informs our ongoing management of COVID-19 in Canada, I'll begin with some of the latest overall numbers. There have been 175,559 cases of COVID-19 reported to date, including 9,557 deaths. Labs across Canada continue to test at a high rate, with an average of over 71,000 people tested daily last week, and 2.5% of these testing positive.
Bonjour.
Good day. Today we'll provide an update on national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. But first, I'll begin with the latest overall numbers. There have been 175,559 cases of COVID-19 reported to date in Canada, including 9,557 deaths. Laboratories across Canada continue to test at a high rate, with an average of over 71,000 people tested daily last week, and 2.5% of these testing positive. In the following presentation, we'll discuss the national epidemiological picture of COVID-19 in Canada and have a closer look at the regional presentations of the pandemic.
Slide 2. The national case count has doubled since our last epidemiology and modeling update on September the 22nd. Yesterday, with over 2,400 new cases reported, we had the highest one-day increase in reported cases since the start of the pandemic. The acceleration of epidemic growth is concerning. The actions of individual Canadians are needed now to reverse this trend.
Diapositive 2.
Slide 2. The national daily case count has doubled since our last epidemiology and modeling update on September 22nd. Yesterday, with over 2,400 new cases reported, we had the highest one-day increase in reported cases since the start of the pandemic. This acceleration of epidemic growth is concerning. The actions of individual Canadians are needed now to reverse this trend.
Slide 3. As we've said before, these national trends are a composite of the regional epidemics that vary widely across the country. The incidence of COVID-19 is increasing in several provinces, with the most rapid increases occurring in Quebec, Ontario, and Alberta. In contrast, there has been no significant resurgence of cases in the Atlantic bubble, and there has been no community transmission of COVID-19 in the territories.
Diapositive.
Slide 3. As we have said before, these national trends are a composite of the regional epidemics that vary widely across the country. The incidence of COVID-19 is increasing in several provinces, with the most rapid increases occurring in Quebec, Ontario, and Alberta. In contrast, there has been no significant resurgence of cases in the Atlantic bubble, and there has been no community transmission of COVID-19 in the territories.
Slide 4. So the time-varying effective reproduction number, or RT, represents how many people are being infected by each new case. When each new case infects less than one person, the epidemic will die out. Canada's RT has been greater than 1 since the end of August, meaning that every 100 cases in Canada is passing the virus to more than 100 others, and so on, with each new generation of spread getting a bit larger. We need to limit our contacts and opportunities for the virus to spread to bring that RT below 1 again.
Diapositive.
Slide 4. The time-varying effective reproduction number, also known as RT, represents how many people are being infected by each new case. When each new case infects fewer than one person, the epidemic will die out. Canada's RT has been greater than 1 since the end of August. This means that every 100 cases in Canada passes the virus to more than 100 others, and so on, with each new generation of spread getting larger. We need to limit our contacts and limit opportunities for the virus to spread in order to bring the RT below 1 again.
Slide 5. This map shows health regions with the highest incidence rates of COVID-19 over the past 2 weeks in the deeper shades of blue. Relative to our last update on September the 22nd, more health regions are reporting incidence rates of over 50 cases per 100,000 over the past 14 days, including additional northern and rural areas. The number of active cases is also rising in First Nations communities, with a majority of cases in Alberta, Saskatchewan, and Manitoba.
Diapositive 5.
Slide 5. This map shows the health regions with the highest incidence rates of COVID-19 over the past 2 weeks, shown in deeper shades of blue. Relative to our last update on September 22nd, more health regions are reporting incidence rates over 50 cases per 100,000 over the past 14 days. This includes additional northern and rural areas. The number of active cases is also rising in First Nations communities, with the majority of cases being in Alberta, Saskatchewan, and Manitoba.
Slide 6. Since the beginning of September, the incidence of COVID-19 has been increasing across all age groups. While we have consistently observed the highest incidence of COVID-19 among young adults aged 20 to 39 years, we're now seeing a concerning rise in the incidence among individuals 80 years of age and older, who are at the highest risk of severe and fatal outcomes.
Diapositive 6.
Slide 6. Since the beginning of September, the incidence of COVID-19 has been increasing across all age groups. While we have consistently observed the highest incidence of COVID-19 among young adults, aged 20 to 39 years, we are now seeing a concerning rise in the incidence among individuals 80 years of age and older, who are at the highest risk of severe and fatal outcomes.
Along with the climbing daily case counts over the past several weeks, an increasing number of outbreaks have been reported in a variety of settings. Although there have been over 250 schools across the country reporting 2 or more cases, only 50 of these clusters involve 5 or more cases, with little indication of transmission happening within the school environment to date. Of concern are the growing number of outbreaks in long-term care facilities. While these involve smaller case numbers than in April and May, We must do everything possible to limit the size and impact of outbreaks in these high-risk settings. At the same time, a larger number of outbreaks are being reported related to private indoor gatherings, which several jurisdictions have noted are contributing significantly to the spread of COVID-19.
Diapositive 6.
Slide 7. Along with climbing daily case counts over the past weeks, an increasing number of outbreaks have been reported in a variety of settings. Although there have been over 250 schools across the country reporting 2 or more cases of COVID-19, only 50 of these clusters involve 5 or more cases, with little indication of transmission happening within the school environment. Of concern are the growing number of outbreaks in long-term care facilities. While these involve smaller case numbers than in April and May, we must do everything possible to limit the size and impact of outbreaks in these high-risk settings. At the same time, a large number of outbreaks are being reported related to private indoor gatherings, which several jurisdictions have noted are contributing significantly to the spread of COVID-19.
Slide 8. Currently, the number of COVID-19 cases in hospital daily remains much lower than the peak of 3,000 cases observed during the initial wave, due in part to the younger age of cases in recent months. However, hospitalizations are considered late indicators of disease severity because they lag 1 or more weeks behind the increase in cases. We're now observing an increase in hospitalizations in some regions, and the overall number of COVID-19 cases in hospital per day has more than doubled from 380 cases at the time of our last update to 820 cases in hospital yesterday.
Diapositive 8.
Slide 8. Currently, the number of COVID-19 cases in hospital daily remains much lower than the peak of 3,000 cases observed during the first wave. This is likely due in part to the younger age of cases in recent months. However, hospitalizations are considered late indicators of disease severity because they lag 1 or more weeks behind the increase in cases. We are now observing an increase in hospitalizations in some regions, and the overall number of COVID-19 cases in hospital per day has more than doubled from 380 cases at the time of our last epidemiology update to 820 cases in hospital yesterday.
Slide 9. As with hospitalizations, deaths are also late indicators of COVID-19 severity and can lag behind increases in reported cases by several weeks, owing to the prolonged natural history of the disease. After more than 2 months observing fewer than 8 deaths reported daily on average, over the past week, the average number of deaths reported daily has increased to 18.
Diapositive 9.
Slide 9. As with hospitalizations, deaths are also late indicators of COVID-19 severity and can lag behind increases in reported cases by several weeks. This is owing to the prolonged natural history of the disease. After more than 2 months observing fewer than 8 deaths reported daily on average, now over the past week, the average number of deaths reported daily has increased to 18.
To October the 2nd. Short-term forecasting shows the predicted cases and deaths due to COVID-19 out to October the 17th. The graph on the left shows the predicted number of cases could be in the range of 188,150 to 197,830 by October the 17th. The graph on the right shows the predicted number of deaths could be in the range of 9,690 to 9,800 by October the 17th. Note that the line tracking cumulative deaths increases in a single step by 114. This does not reflect a single-day increase, but rather the reconciliation of data from Ontario for deaths that occurred in the spring or summer. The forecast has been adjusted to account for this new information.
Diapositive.
Slide 10. Based on Canadian data up to October 2nd, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to October 17th. The graph on the left shows the predicted number of cases could be in the range of 188,150 to 197,830 by October 17th. The graph on the right shows the predicted number of deaths could be in the range of 9,690 to 9,800 by October 17th. Note that the line tracking cumulative deaths increases in a single step by 114. This does not reflect a single day increase, but rather the reconciliation of data from Ontario for deaths that occurred in the spring or summer. The forecast has been adjusted to account for this new information.
Slide 11. This graph shows the results of dynamic modeling studies that look at how the epidemic may evolve in Canada over the next month. Based on the current increasing daily case counts, the graph shows that if we maintain, that's the gray line, or increase, that's the orange line, our current rate of contacts with other people, the epidemic is forecast to continue increasing steeply. More importantly, in order to bend the epidemic curve and reduce transmission to lower levels as shown by the blue line, we must decrease our current rate of contacts by 25 to 35%. We can reduce our rate of contact with other people through a combination of individual practices and population-based measures. However, in some areas, individual actions have not been enough to realize low levels of transmission, and additional measures, including strategic business closures, have been required in order to put the brakes on the epidemic growth.
Diapositive.
Slide 11. This graph shows the results of dynamic modeling studies that look at how the epidemic may evolve in Canada over the next month. Based on the current increasing daily case counts, the graph shows that if we maintain or increase our current rate of contacts with other people, the epidemic is forecast to continue increasing steeply. The gray line means it maintain and the orange line means increase. More importantly, in order to bend the epidemic curve and reduce transmission to lower levels, as showed by the blue line, we must decrease our current rate of contacts by 25 to 35%. We can reduce our rate of contact with other people through a combination of individual practices and population-based measures. However, in some areas, individual actions have not been enough to realize low levels of transmission, and additional measures, including strategic business closures, have been required in order to put the brakes on epidemic growth.
Slide 12. If strategic closures are needed to reduce contacts between individuals, results of dynamic modeling shows us that acting fast will have the greatest impact. The top right and the bottom left images on this slide shows the contrasting results of a slow versus a fast implementation on the number of cases. Decisions on where and when to target measures will continue to be locally driven based on consideration of the incidence of COVID-19 and strain on the public health and health system. We are at an important juncture in the pandemic where we would very much like to see the voluntary actions of Canadians across the country be sufficient to bend the curve downward. This will require sustained and intentional efforts to limit contacts and reduce opportunities for transmission. This will not be easy and will require hard choices between what we need to do and what we would like to do.
Diapositive.
Slide 12. If strategic closures are needed to reduce contacts between individuals, results of dynamic modeling show us that acting fast will have the greatest impact. The top right and bottom left images on this slideshow show the contrasting results of a slow versus fast implementation on the number of cases. Decisions on where and when to target measures will continue to be locally driven based on consideration of the incidence of COVID-19 and strain on the public health and health system. We are at an important juncture in the pandemic where we would very much like to see the voluntary actions of Canadians across the country be sufficient to bend the curve downward. This will require sustained and intentional efforts to limit contacts and reduce opportunities for transmission. This will not be easy, and it will require hard choices between what we need to do and what we would like to do.
Slide 13. Given the epidemic is unfolding differently across the country, it is important to stay up to date on the situation in your area. There are a number of tools available to help you stay informed and assess your regional and personal risk.
Diapositive 13.
Slide 13. Given that the epidemic is unfolding differently across the country, it is important to stay up to date on the situation in your area. There are a number of tools available to help you stay informed and assess your regional and personal risk.
So, slide 14. We are all faced with unique circumstances this Thanksgiving weekend and into the fall and winter. This is often a time for family gatherings and celebrations inside cozy homes. But our celebrations need to look different this year. Keep it small, keep it safe, and protect your families, friends, and yourselves. The epidemic's trajectory is not inevitable. There is much we can do now to limit the impact of COVID-19 on the lives and livelihoods of Canadians. Let's act together so our actions can reduce the spread of the virus. Let's start today. Thank you.
Diapositive
Slide 14. We are all faced with unique circumstances this Thanksgiving weekend and into the fall and winter. This is often a time for family gatherings and celebrations inside cozy homes. But our celebrations need to look very different this year. Keep it small, keep it safe, and protect your families, your friends, and yourselves. The epidemic's trajectory is not inevitable. There is much we can do now to limit the impact of COVID-19 on the lives and the livelihoods of Canadians. Let's act together. Our actions can reduce the spread of the virus. Let's start today. Thank you.
Thank you, doctors. We'll now turn to the phone for questions. Just as a reminder, as there's a number of different things to talk about today, the Prime Minister will be available for about 20 minutes of questions, and then the ministers and doctors will be available afterwards. We'll start on the phone. One question, one follow-up. Operator.
Thank you, merci. First question, Kate Bolingaro, Bloomberg, line open.
Good afternoon, Prime Minister. I have a quick question for you regarding what's happening in the U.S. With a right-wing militia plot to kidnap Michigan's Democratic governor foiled, which is a direct state that is directly our neighbor, and increasing polarization across the U.S., should Canadians be worried about the possibility of U.S. election violence?
In Canada, we have been very alert to incidences of extremist violence, particularly right-wing violence, for some time now. We're going to keep an eye on this situation and continue to keep Canadians safe. Of course, we're watching events fold in the United States in this election season, and while I won't comment on the election situation, I will continue to emphasize that my job and our job as a government is to continue to stand up for Canadian interests and keep Canadians safe. That's exactly what we'll keep doing.
Follow-up, Kate?
Well, and exactly. Since your role is here in Canada, I'm wondering, have Canadian defense, intelligence, and law enforcement agencies been instructed to take any actions or precautions as a result of this violence?
Our security and intelligence agencies continue to monitor things that happen inside our borders and around the world and make decisions designed to keep Canadians safe. We will continue to work closely with our security agencies to ensure that we are doing everything necessary to keep Canadians and our communities safe.
Answer repeated in French. Of course, our intelligence and security organizations are working very hard to keep Canadians safe. In particular, in regards to extreme right-wing extremist violence, we will continue to monitor the situation around the world and to do everything necessary to keep Canadians safe. That is our number one priority.
Prochaine question, operator.
Thank you, merci. Next question, Jamie Pashagumskum, APTN. Please go ahead.
Hi, Mr. Prime Minister. This question is for you. Please interrupt me if you can't hear me. I have bad connection sometimes. It's been 21 years since the Marshall decision, and still Mi'kmaq fishermen are being denied their right to fish. Now, there's a new round of negotiations between the Mi'kmaq and the DFO. My question is, why should the Mi'kmaq have any trust in this process when it's been 21 years and they're still being denied the treaty right to fish? So what do you think they need to get resolution?
There's no question that 21 years is far too long to wait to see rights that have been recognized come into force. That is why, as a government, we have worked so hard on so many different approaches on reconciliation to make up for time lost by previous governments. This is a situation that is extremely important to resolve peacefully. That's why the Minister of Fisheries and others are engaged in discussions and negotiations on a way forward that will be fair for everyone. But we recognize the rights enshrined in the Marshall decision, the rights of Indigenous peoples, and we will continue to work hard to defend them.
Follow-up question, Jamie?
Yes, thank you. Now, in a couple of hours, there's going to be a demonstration taking place in front of the Supreme Court building here in Ottawa. They're calling it Indigenous Rage Against Colonialism. It's sort of encompassing all issues, you know, the Mi'kmaq, the Wet'suwet'en, land occupiers in Caledonia, tiny house, and it shows the moose moratorium. Now, if you were down there, what would you tell these people today?
That I share their impatience. The world needs to, and Canada needs to move further down the path of reconciliation. We have done much over the past years in terms of closing funding gaps for education, in terms of investing in mental health supports, investing in economic pathways, and resolving treaty differences in terms of eliminating long-term boil water advisories. But there is much more to do, and we will continue to work hand in hand with Indigenous peoples. Not just Indigenous peoples want to see this happen, but non-Indigenous peoples as well want Canada to turn its page on its colonial past, and that's what we're all working very hard on together.
Thank you, and we'll take one more question on the phone for now. Operator?
Thank you, merci. Prochaine question.
Next question from Le Devoir. My question is for Ms. Freeland. Ms. Freeland, I would like more details on your announcement on help for businesses. First, on the wage subsidy. You said it will be frozen at 65%, so I understand that the original 75% won't be paid, and you said that this will be done until December. So afterwards, will the rate decrease gradually, as it was planned out under the plan announced this summer?
Exactement ça.
Answer. That is exactly right. We will freeze the program at the level it is now. And after that, it will decrease. And I would like to specify that we are going to freeze it, the wage subsidy program, at the level we have now until December 19th. That will be the end of period 10. Follow-up question. So I understood that after that it will decrease. Now, about the commercial rent assistance. There were complaints that businesses didn't receive enough because they had to go directly through their landlord. How many businesses does your department think it will be able to help with the new rent benefit? And also, regarding all of these new benefits, what are your predictions? Answer. Thank you for the questions. It's difficult at this time to be able to specify how many people will be helped by the new commercial rent program. That is especially because we have a lot of factors that depend on the coronavirus. we have specific aid, that 25% that we will be giving for businesses that are subject to a decision made by public health. And also, as you understand very well, the assistance will depend on income levels. I really want to highlight that what I'm about to say only concerns estimates for our predictions. As Dr. Tam and Dr. New have explained to us, there are a lot of unpredictables when we're talking about the coronavirus. And we all need to respond doing what's right to plank the curve. Now, our estimate in projections for the commercial rent is that by the end of the year, it will cost $2.2 billion. That is for the rent aspect. And I can answer for the other programs if you wish.
Sure. In terms of projections of the cost of the new rent support program, it is impossible to be precise because the take-up of this program will depend directly on what happens with the coronavirus. And so it will actually depend directly on how well Canadians do in flattening the curve. Having said that, of course, we have made some projections, and our current projection is the new rent support will pay out around $2.2 billion between now and the end of the year. And that is both the overall rent support and the additional targeted 25% top-up, which will go to businesses that are subject to a specific additional public health restriction.
Thank you. We'll now go to the room. Mike.
Prime Minister Mike Couture from Global National. The slides that we just saw showed how Canada very clearly crushed the curve in the spring by completely shutting down. Dr. Tam even just said that the epidemic growth is concerning at this point in time. So why does your government continue to favor a more surgical approach rather than another shutdown, which clearly worked?
We know that the epidemic path across the country is very variable. All businesses, all families across the country have been affected by coronavirus, but we are seeing spikes in the second wave in certain areas. We know a lot more about where transmissions are happening, what businesses and what activities create particular vulnerabilities, and that's why in the second wave, we're able to be more targeted in our approach. But let's make no mistakes about it. This second wave is really frustrating for a whole bunch of people who've been through this spring and who don't want to see this happen right now. A whole bunch of us would love to see this simply go away. Well, it'll only go away if we all do our part. Different orders of governments have stepped up in a lot of different ways in terms of testing, in terms of programs, in terms of supports, in terms of health measures to get us to this point. But Canadians have also done their part. Everyone did their part in the spring to flatten that curve and to get us through a decent summer. But now we're in this second wave. And the behaviors people take on this weekend will be things that we look back at 2 weeks ago to see whether we started to shift the direction of this second wave or not. The epidemic potential, the epidemic curve is clear. The actions we take now will determine that. That's why this coming weekend, for Thanksgiving and for the weeks to come, we need people to do everything they can to prevent transmission of this virus. Stay home as much as possible. Listen to the public health advice. Download the COVID Alert app. Wear a mask and really, really pull together and lean in by stepping apart these coming weeks so that we change the direction of this curve. We get things back under control so we don't have to continue to escalate the measures we have. Public health measures and government measures can do part of it, but only citizens can actually determine how this outcomes look over the coming months. That's what we have to step up on now.
Answer on the measures repeated in French. For a number of months, we've been learning what works for COVID. In the spring, we saw that with a national confinement, we were able to massively slow this epidemic. Unfortunately, now we're into the second wave. And we can put out tools and approaches that we know that will be helpful. For example, by targeting our closures, by knowing which business activities are more likely to lead to outbreaks of COVID-19, we can be more targeted in our approach. But make no mistake, it is extremely unpleasant for all of us to have to face a second wave. And I know that so many people just wish it would disappear, but it will only disappear if everyone does their part. In 2 weeks, we will look back at what has happened during this upcoming Thanksgiving weekend, and we'll be able to say if we did the right things or not. People need to be careful to limit their contacts to prevent more COVID-19 outbreaks. And how do we do this? By keeping our distance, by staying home as much as possible, by downloading the COVID Alert app, by doing the things that we know will bring benefits in the coming weeks. It's no fun, but we all have to do our part to get through it together.
Prime Minister, one of Dr. Tam's slides was titled "A Stronger Response is Needed." And my question is, where is it? What is the response from your government other than telling people to download an app and not gather for Thanksgiving? At what point do you say the things that premiers have been doing aren't working, especially here in Ontario? When do you step in? Will you consider using emergency public health measures, the powers you have, to actually manage the response to the epidemic and not just use moral suasion to convince people not to gather?
As we've seen across the country, there are places where the epidemic curve has functioned differently than others, where measures that have been put forward have been successful. The Atlantic bubble is an obvious example, but even across the other provinces, we've seen tremendous variances in effectiveness of various measures and in population behaviors. So we will continue to be there to support the premiers, to support governments in the decisions they make in the interests of their local situation. Our responsibility, as we've laid out, is to continue to support Canadians directly. The CERB through the spring, the wage subsidy through the spring, were things that allowed people to do what was necessary to prevent the spread of COVID-19. And as we laid out in the throne speech, we don't want local public health officers to have to make impossible decisions about what they have to do to close down, without knowing that there is going to be support for businesses, for Canadians facing a local or regionalized shutdown. That's why the measures we are announcing today are targeted specifically so that people can make the local public health decisions and recommendations necessary to control this epidemic and know that businesses and families will be supported through these decisions. That's the role of the federal government in this, to support people, to support provinces in the decision-making they're making, to ensure the availability of technologies and supports, to move forward on things like the COVID Alert app, which can and will and is already making a difference in impact around COVID-19. These are the things we will continue to do because these are the things that keep us safe. Of course.
So, Prime Minister, if I may just underline one really important point the Prime Minister has made. Something that we have all heard as MPs and as ministers, I'm sure you have heard as reporters, is local businesses really, really concerned about new, more restrictive public health measures being imposed. And we are certainly hearing from the provinces and territories, from municipalities, from public health officials across the country, that many of them feel themselves to be in a really agonizing position of frankly knowing what is the right thing to do, but being reluctant to hurt businesses that are already very hard pressed. And that's why, from my perspective, one of the most important things we've announced today is a really novel program, which is this 25% top up for businesses subject to lockdown restrictions. And what we are aiming to do with this program is to provide the support to public health authorities, to local officials, to do the right thing without fearing that by doing so, they will be hollowing out these businesses that are so important in their communities. So that's a really concrete action that we are taking. And I think we all really hope that with these measures in place, with this safety net in place, public health officials and local authorities will be really empowered to do the right thing.
Bonjour, Christian Noël de Radio.
Question from Christian Noël from Radio Canada. A question for the Prime Minister and Deputy Prime Minister. We had the impression at one point that the money was flowing and we didn't even have time to count. And now these measures are targeted, and we're talking about paybacks as well. However, the second wave could be worse than the first. So why limit the spending when the needs are greater? Answer, Prime Minister. We are limiting the expenses to mitigate this reality of the second wave. We hope we will be able to prevent a second national confinement. We are looking at what we can do in certain regions to limit the spread of the virus. And what we're doing is not a matter of limiting or restricting the money flowing to these businesses, as the minister said. Rather, this direct aid to businesses that are subject to closure measures is at 90%. It is extremely generous aid. And what we've seen in the second wave around the world is that properly targeting the needs is better than to restart a generalized confinement. It's better for the economy. It's less unpleasant for citizens. We take what we learned and what the world learned from the first wave, and we use it to find a better way to live with the pandemic and to reduce outbreaks at the same time. This is exactly what is needed. The provinces are doing their job by looking at what needs to be done at each step. For us, our job is to make sure we're there to support Canadians, support small businesses, and businesses impacted by these public health and medical decisions, which are necessary decisions.
Sorry, go ahead.
Le Premier ministre a répondu parfaitement.
The Prime Minister answered perfectly. I have nothing to add.
Hi, Prime Minister. Tom Perry from CBC. My question is actually for you and for the Deputy Prime Minister. On the rent relief program you're announcing today, you're going to be giving support directly to businesses now, whereas before the money was going to landlords. In making this change, are you acknowledging that that first plan was flawed? And if this was a miscalculation, are you worried that you may have inadvertently caused some businesses to go under?
I think during the first wave of this pandemic, we understood how important it was to try and support people in as many different ways as possible. Now, the secret program actually helped hundreds of thousands of businesses that were able to benefit from that reduction in rent. And we did it in a way that made sense for us to work with landlords, with the tenants, and with the provinces as well that have jurisdiction over the commercial rent program. But as we've seen, this second wave requires more targeted help that flows differently. And we heard clearly from tenants who were frustrated or had landlords who weren't able to participate in the original program. So we made modifications and are coming forward with a support program directly for tenants in commercial businesses. Christian?
Yeah, and the only thing, I would just add a few things to that. One of the reasons that we're providing the rent support in the way that we have outlined today is to simplify everything that is available to businesses. So it's going to be delivered through the same platform and along the same lines as the wage subsidy. Life is very complicated for Canadians right now and unpredictable. And COVID is complicated and hard enough for businesses to deal with. We want to make government support as straightforward and as simple as possible. So, operating in tandem with the wage subsidy was a real, desire of ours. So that would be one thing. The second thing, which I think is an advantage of how we propose to deliver this program, is, as the Prime Minister said, it's flexible. So it's not one size fits all. There is a range of support you get with your rent based on what your fall in revenue is. And the reality, that we saw from the doctor's presentation is we don't know what the progress of the coronavirus is going to be. We're seeing that it goes up and it goes down. And we have sought to build a rent support program that can respond to those needs of a business. And then the final thing which we wanted to do with this program was create something which could also be used to deliver this targeted, lockdown triggered additional support. And the way we have put together the rent support program allows us to do that too without having a whole new program.
It's Man Hamidi from the Canadian Press. I want to ask you about the by-elections in Ontario. If Ontario is ruling back public gatherings and we're seeing obviously the cases are going up on record numbers, would you consider delaying or suspending the elections and maybe rescheduling them for a later date?
One of the things that has been important, I think, for Canadians through this massive disruption that is the pandemic is our democracy and our democratic institutions have continued to function. We've seen that with Parliament continuing to work together in a hybrid model and deliver programs for Canadians with all parties working together. We've seen that with a number of provincial elections gone ahead and underway right now. It is reassuring to Canadians to see that their democracies continue to function even in this difficult situation. The way we work is different, and certainly the way people are campaigning is taking into account the reality of COVID-19. But our institutions are strong and can continue to function. I'd also highlight that it is mandated by law that we hold these by-elections before February of this year. And knowing that, we looked at the calendar and looked at the potential arrival of flu season, of wintertime, of the uncertainty around a second wave. We made a determination that moving forward quickly on these by-elections was probably the safest thing to do. There are a few weeks left in that by-election, but there has been campaigning in a safe way up until now. And we see that holding a by-election later in the winter, in January or February, is extremely uncertain in terms of what the situation might be. So I think for the good of everyone who is already underway in this and behaving safely, we've seen candidates and campaigns take into account the reality that we're going through. And I think Canadians can have confidence that our democracy remains strong even in the middle of this pandemic.
Answer repeated in French. It's important to highlight how much Canadians were comforted to see that our democratic institutions have continued to function, even through an extremely difficult situation of a global pandemic. We saw this when Parliament continued to sit virtually to continue passing laws to help Canadians. And also, we saw it with elections that are taking place safely across Canada. Of course, people need to be careful, and campaign approaches need to be modified. I would also like to add that, according to law, we must hold these by-elections in Toronto before February. And we took into account flu season and the upcoming winter season and uncertainty about whether the pandemic would worsen. And we made the decision to hold the by-elections sooner than later. That is to say, to hold them before the snow fell and where we would risk more complications. However, adaptations to local regions is necessary, and candidates need to communicate safely with citizens during this democratic exercise.
Prime Minister Tonda McCharles at the Toronto Star. Canadians have voted in winter months before, but I'm curious, given that Ontario today, their own modeling says that the province could experience worst-case scenarios seen in northern Italy and New York City, where hospitals were overwhelmed. Your decision not to postpone that by-election, today we have one of the candidates actually campaigning there, calling for it to be postponed. If the Elections Canada officer has the ability to at least recommend it, are you saying that your cabinet won't be open to postponing that election?
We will always listen to and work with Elections Canada and their recommendations. At the same time, the very modeling you're pointing out, Tonda, is highlighting that it's likely to get, it's at least possible that things get worse over the coming months. And because by law, we have to fill that by-election, have that by-election before February, a few months from now, it is very likely that postponing the by-election until the last possible moment would actually mean that it would be held in more difficult circumstances. We've already had a number of weeks of campaigning in this by-election in reasonably decent circumstances. Who knows what the next months could bring? We certainly hope things get better, but they might not. And I think it is reassuring to Canadians that we can continue to move forward with democratic institutions in safe, socially distanced ways, through a lot more virtual contacts, through ensuring we're doing everything we can to keep Canadians safe and keep candidates safe, while at the same time reassuring people that even in the midst of a pandemic, our democracy is strong, our institutions are strong, and our capacity to adapt and continue to make sure that everyone has strong voices to speak up for them, particularly in this difficult time, is respected. There are 338 seats in that House of Commons, and every Canadian deserves to have someone out there fighting for them, particularly in this pandemic. And the people of Toronto Centre and York Centre certainly deserve to have their voice on the floor of the House of Commons in the coming months as we make difficult decisions to support Canadians through this difficult pandemic.
Thank you, Prime Minister. Prime Minister and Dr. Tam will now excuse themselves, but the ministers and Dr. New will be available for a few more questions. So just if we take a moment, and then we'll go back to the phone. We'll have both doctors here, actually. But we'll go back to the phone with, we'll start on the phone. Operator?
Thank you, merci. Prochaine question.
Next question from Catherine Lévesque from the Canadian Press. Hello. Ms. Freeland, I believe you're still there. Could you please finish your answer and give us an idea of the other costs for different programs? Answer. Yes, it would be my pleasure. So, for the direct aid for businesses through CBA, the Canada Emergency Business Account. Pardon me a moment. Yes, CBA. I would like to underline that we made a significant change. That is, that given this second step for the Canada Emergency Business Account, it will be necessary for businesses to attest to the fact that the business suffered revenue loss. As the Prime Minister explained, our intention during this second wave is to give support to the economy and to businesses, but for that aid to be targeted around businesses that specifically have the need. And why do I highlight this? It's because when it comes to micro businesses, it is very difficult to determine who will require aid. But in saying that, we have made very prudent estimates, and we believe that the program will cost $11 billion. And I also announced details. For example, the prolongation of the wage subsidy. At this time, the numbers are published on the government website. Until October 4th, the wage subsidy helped businesses out with costs with a little over $41 billion. That is to date. Now, regarding the changes announced today, we froze the level. We think that this will be up until the end of phase 10, which will end on December 19th. And that amount will be $6 billion. But once again, I would like to highlight that that will depend on the costs and depend on what will happen with the coronavirus. Follow-up question. Do you have any estimates for the wage subsidy for up until the month of June? And I also have a question for the doctors. On the modeling, slide 11, we see that there are a number of curves. There are gray and orange curves. They're almost identical. Could you please specify the difference between the increase in cases if we keep the same number of social contacts and the other number if we increase the number of cases of social contacts? Thank you. Answer. Chrystia Freeland. Today we only announced the specific details regarding the wage subsidy up until the end of phase 10, which is until December 19th. And so I will make financial projections only until that time. That is because we have not yet announced exactly what we will be doing exactly with the levels of the wage subsidy until next summer. I am very pleased to confirm that the wage subsidy will be extended until the summer. However, now is not the time to announce to what extent or to what level. Dr. New. For the other question, it's on slide 11. So regarding the orange and the gray curves, these are both downward curves. And what we really want now is the blue curve. What we want is to decrease the number of contacts by 25 to even 35% in order to see a difference a couple of weeks from now. I would even say that it is a crisis moment. We're at a turning point. And the key message for everyone is that we should only be in contact with members of our own household. And that doesn't mean family members, because as we know, members of the same family can live in separate houses. Let me give you a personal example. My oldest son lives in Montreal. Given what is happening in Quebec City and Montreal, and even here in Ottawa, given the red zones, it's difficult to make decisions. with his girlfriend, my son had purchased train tickets to come and visit us because this weekend is usually a time for family celebrations, but not this year. We will not be doing it. Canadians need to pay attention what is happening in their region of the country especially where we see a resurgence of cases.
Make some projections because of how much take-up you don't know yet might happen, but roughly you must have some projections about what you're looking at based on the experience we've seen to date. I didn't quite get the totals you were talking about, so if you could repeat that, and given your earlier comments about how now it's time for the public health authorities to do the right thing, knowing that they won't threaten businesses if they have to close them. Do you feel that the time it took to roll these out did actually result in or fuel or lead to the resurgence we're seeing?
Okay, so yes, I do think it's important to emphasize that because of the way these programs are designed, the ultimate amount of money that will be devoted to the support of businesses is very hard to know precisely because it's going to depend on what happens with the economy. And a way to think about it is what we are creating in terms of business support is some automatic stabilizers that are quite similar to the way that employment insurance works. And so it's really going to depend on what happens with the economy, which depends on what happens with coronavirus. But I think that it is entirely correct for people to know that we have projected and have some idea of how much the different programs will cost. And let me go through that again. So on the rent support measures, and that includes the support for, this additional 25% top up for businesses that are subject to specific lockdown restrictions. We are forecasting that will cost around $2.2 billion between now and the end of the year. And this might be a good moment to emphasize that what we would like to do with this program is make it retroactive to September 27th, which was the beginning of the current wage subsidy period. I think that's important for businesses and for governments and public health authorities across the country to appreciate. So that's the rent support. On this top up of the CBA, the small business loan, our projection is that additional top up will be $11 billion. And I would say it's important for people to know that there is some degree of uncertainty because we are adding an attestation where businesses will need to attest that they have suffered revenue loss because of the pandemic. And this is in keeping with our desire to really, insofar as possible, make these programs targeted to the businesses who need it. And then finally, with the wage subsidy, what we've done is, what we propose to do is to freeze the wage subsidy at the current rate of 65% rather than go in the step down, rather than continue the step downs, which we had announced over the summer. And this is very consistent with our announcement in the throne speech that the wage subsidy is going to last until the summer, and also consistent with the fact that we are in a second wave. Our projection is that this freezing of the wage subsidy will add an additional $6 billion to the cost of the wage subsidy up until December 19th, which is the end of period 10. And we are today proposing a freeze of the wage subsidy until the end of period 10 at the current levels, so until December 19. So that is as far as I'm going to go in projections of how much it's going to cost, because that's the changes that we're talking about.
Thank you.
The second part. Tanda, I am really glad that we are able today to announce the details of a really novel approach. It's something that we committed to in the throne speech, and you have heard the Prime Minister in question period, and you have heard me in question period commit to Canadians that we would be providing additional support to businesses subject to lockdowns. So that commitment, that promise has been there since the throne speech. We have underscored it, recommitted to it publicly a number of times. And in our own private conversations with leaders across the country, we have been clear that that support would be there. It's an entirely new approach, and it's something that hasn't been done before. It was important for us to have enough of the technical details in place to make an announcement that had real weight, and that's what we've done today. What I will say is I really do hope that knowing that this lockdown specific support is in place will help the public health officials, the leaders across the country who are charged with making those agonizing decisions about additional lockdown restrictions, will help them to do the right thing.
Thank you. We'll now go to the phone for one more question. Operator?
There are no further questions. Nous avons plus de questions pour le moment.
Okay, we'll go over to Tom.
Hi, my question is for Minister Hajdu and for the doctors as well. It's on home testing. At this point, I don't think Health Canada is considering any home COVID tests at this point. I'm wondering why that is. If it's just that no one has put forward a home test for approval, or if there's concerns on the part of Health Canada about, I guess, the effectiveness of home tests, and if there are, what are those concerns?
I'll start in general and then turn to the doctors to talk about the pros and cons of home tests. The full list of applicants is on the website now, so people can actually go to our website and see all of the companies that have applied and what the status of their application is. And I'll have to check to get back to you in terms of whether or not we've got any of these candidates that have applied. You know, look, we're really excited about innovation and testing, and the challenge is we've just got to also make sure that there is a certain degree of certainty and a certain degree of guidance in terms of how we would use these particular tests. And I know that countries around the world are looking at the possibility of using this test. Some have approved them and pulled them back because they've actually made situations even murkier in communities. You know, we've seen high-profile cases of self-administered tests or rapid tests being used as a way to substitute for screening with disastrous effects. And so the work that Health Canada is doing is both on the accuracy of the test within a certain parameter when they're assessing any kind of rapid test, but also working to understand how that test might be used and how it would be seen as valuable or not to the public health authorities in all across Canada that would then be responsible for somehow managing the introduction of that particular test. Dr. Tam, did you want to take a bit to talk about testing?
Sure. I mean, I think I try to stay close to my colleagues in the regulatory arm of Health Canada, and I don't believe there's any submissions for, I think what you're talking about, which is someone can easily just do the test at home and get a result. That kind of application has not come through. And I think, as the minister said, there's not that many examples of this being approved around the world. I mean, I think other forms of rapid tests, which we talked about, we have examined and provided the guidance for. Certainly, without having some of these tests with published information, it's difficult to know how accurate they are. So, of course, that would have to be evaluated. But I think we have to remain open to, obviously, these submissions. So what would you do as an individual if you got a test positive? That's the next thing, and you have to be connected to the public health system. I think from a public health officer's perspective, they are a bit concerned if the tests are used at home or in some sort of workplace, that they have to have a linkage in how that works because there's public health actions that come as a result of that. Then the next issue is, even now, some of my colleagues have been telling me that people who had a test taken, that is to say they think they might have COVID for any chance of it, are still working and going about their daily lives, and hence some of these transmissions. So you got to say, well, why? I mean, if you even had a test, you're not sort of staying put and doing the right thing until your test results comes back. So maybe the shortening of the turnaround of the test results would help. But one of the fundamental issues, and I think relates to some of the announcements today, is that people can't afford to not work. And so what do you do with that result? You have to support the individual for doing the safe thing and to connect with public health. So I think it is a complicated issue. It's not just about the test itself, and then it's the contact tracing and the isolation. Everything has to come together. And so I think, but we're absolutely open to examine any of that kind of technology.
Hi, Deputy Prime Minister Marika Walsh with the Globe and Mail. Can you clarify, will the funding for the new rent relief program be retroactive to April for businesses whose landlords refused to participate in the first program, that businesses were not able to get it? And if not, why not?
No, it will not. This is a going forward program. The objective of this program is to keep the businesses that are operating today viable and to help them get through the second wave. So we are very much looking forward. We are very much focused on acting in a targeted way and in a way which is designed to bridge our businesses, to bridge our economy through the second wave, through the winter, through to the end of the coronavirus. And for that reason, it seems sensible to us to be looking ahead and to what businesses are doing and how they are operating in the future. There is one element of retroactivity that I do want to emphasize, which is, as outlined today and as proposed by us, the new rent support would be retroactive to the current wage subsidy period we are in, which began on September 27th. So it would cover this month. And the existing CECRA program goes through to cover rent for the month of September, so this then covers the next month. And the one other thing I would say on the rent support is CECRA has now ended. The province is committed to providing support as part of the CECRA program, and there is some unspent money in some provinces for that program, around $72 million across the country that they had set aside. And I'd like to take this opportunity to encourage the provinces that have some unspent money that they had set aside for CECRA, for rent support, for supporting small businesses. I think it would be great if they could use that money to find ways locally to support their small businesses on top of what we're doing.
Thank you. That concludes today's press conference.
Legislation to do this now, or is it?
That's actually a good question, which I would like to answer. I was surprised no one asked about it.
We're being cut off from questions, and since it's such a big package, we still have some questions like that.
Tonda, I am very happy to answer a few more questions, if that's okay. Do you guys permit me?
Dr. Tam as well?
I can't speak for Dr. Tam. She is a very busy doctor, so maybe Tonda quite rightly said we've unrolled some big economic measures. I'm happy to answer a few more questions about them.
I understand a number of the doctors or ministers do have to be other places right now, but if the minister would like to answer.
Yeah, is that okay? Okay. So excellent question, Tonda. And the reason that I have couched in the conditional some of my answers about these programs is the rent support and the changes to the wage support will indeed require new legislation. My office, even as we speak, is briefing the opposition parties about these programs, and I very much hope that they will support us with alacrity on them. As you pointed out in one of your questions, Tonda, I think this is support that Canadian businesses really need as we see the case count of coronavirus rising. And I will also point out that both the Prime Minister and I have had questions from opposition parties in question period asking when this kind of support, which was promised in the throne speech, will actually come. So I hope that now we've offered details of how we propose to do it, we will be able to work quickly to make it happen.
I just have a question for Dr. New. Sorry. You're calling on Canadians to continue to limit contact. That doesn't seem to be working according to the graphs that you've shown today. A spring shutdown did work. Given what we're seeing in the trend line, as the one of the top doctors of the country, would you prefer to see another spring-like shutdown?
I think the easy answer to that is that I don't think it's as easy as saying that there could be or should be a lockdown across the country. As the Prime Minister himself stated, there's vast differences between different parts of the country in terms of their actual situation on the ground, in terms of the epidemiology. And even in the province of Ontario, I understand that the province of Ontario will be announcing specific measures because there are hotspots. I think Ottawa, City of Toronto, Peel Region, York Region have been identified hotspots. And I think based on what we've learned from the science and how the virus is transmitted and so on, I think a more targeted approach at a regional level is the way to go. I think Canadians have made a lot of sacrifices. We certainly succeeded in, as you say, flattening the curve back in the spring, and I'm certain we can do it again. But I think we have to, balance it with obviously keeping our society and the economy going in sort of the best way possible, while obviously doing what's the right thing from a public health perspective. It's simple at the end of the day. It's really the number of contacts that matters, and the type of contact. As I mentioned at an earlier press conference, when we had confirmed cases back in the spring, when public health and contact tracers interviewed these people, they were identifying, we've been staying at home. We've had 5 or 6 people we've been in contact for the past 2 weeks. Now, when the contact tracers go out for confirmed cases, it's in the dozens or even 60 or 70 people. And why is that? So, I did go to this party, or I did do this and that, and 60, 70 people. And that's overwhelming for public health. So I think it really comes down at the end of the day to individual Canadians. Think really about, if you were to be contacted about public health, would you be embarrassed to try and think back and how many people you've been in contact with for the past two weeks? Leave it at that.